Kim, good afternoon. A few questions for you to answer if you wouldn't mind. It says, global health seems to be in the news more and more in recent years. Talk about which global health is and why it's important to pay attention to it.
Well, I think the U.S. Institute of Medicine provides the best definition for global health. They refer to it as health problems, issues, and concerns that transcend national boundaries and may be addressed by cooperative actions. It's extremely for all of us to pay attention to global health because it affects all of us. As our country has travelers that leave in and out of the country, certain other health issues are important for travelers to be aware of before they travel, and we should be aware of health issues that exist as we're traveling somewhere. Focusing on global health also allows our developing countries to help the undeveloped countries know more about and take advantage of best practices or solutions that developed countries have so that we can help each other.
Kim, another question for you. Disease comes in different ways. Could you explain communicable versus non-communicable disease?
Well, communicable diseases are infectious diseases that are caused by pathogenic microorganisms such as bacteria, viruses, parasites, fungi. The diseases can be spread directly or indirectly from us, from one person to another. Communicable diseases can come to the U.S. on clothing or your luggage or other sources as we travel to and from other countries. Communicable diseases are also very contagious and they spread through bodily fluids, whereas non-communicable diseases are things such as heart disease, stroke, cancer, chronic respiratory diseases, diabetes. Non-communicable diseases are by far the leading cause of mortality in the world, representing 60% of all deaths. Our environment, the foods we eat, our genetics, and where we live play a large role in who contracts non-communicable diseases.
Okay, Kim, let's talk about Ebola. Since there's been a lot of our viewers, I'm sure, have heard a lot about it over the past few years. What is it? Is it communicable? Is it non-communicable? How do people get it?
Well, Ebola is a communicable disease. People get Ebola through direct contact through broken skin or mucous membranes in, for example, the eyes, nose, or throat. Basically, it's bodily fluids. So consider things like urine, saliva, sweat, feces, vomit, breast milk, and even semen of a person that was sick or has died from Ebola. Ebola can also be contracted through objects such as needles, syringes, that have been contaminated with the bodily fluids of a person that's been sick with Ebola, or even someone that died from Ebola. It's even possible to consider that someone could contract the disease from contact with semen from a man that has recovered from Ebola. And lastly, but probably least likely, from an infected fruit bat, ape, or monkey that was infected with the disease.
So, Kim, what would raise a person's risk of getting Ebola?
People should be cautious. When traveling to infected areas and regions of Africa, the CDC can also always provide advice and guidance if you must travel to a region that has people infected with the disease. It's also important to stay away from health facilities that have treated people with this disease. But again, CDC can provide you guidance and give you the right information so that you can have the care received at the right facility if you need care outside of the United States. But here in the United States, it would probably be most important to consider be very careful and play caution when in contact or treating anyone infected with the disease or working with the deceased. This would mainly affect healthcare workers, and training has been provided extensively to reduce their risk.
So, to at least prevent or lessen the chance of getting Ebola, what should people do?
Well, basically people should follow the CDC guidelines that have been put into place when traveling or when treating someone who has contracted the disease. In the United States, there are significant safety procedures that must be followed for people entering the country after visiting those areas. Even airlines and cruise ships have procedures to follow if anyone is sick or present the illness on their vessels. So really, to prevent or lessen the chance of getting Ebola, especially as it's only contracted through bodily fluids, simply avoid bodily fluids of anyone who has contracted the disease and report anyone presenting symptoms of the illness to your local health authorities.
Okay, outbreaks such as the one related to Ebola that we've been talking about can generate a lot of rumors and misinformation, even spread panic among the public, and how is that disease, how is it transmitted, and how likely are people to get it? Talk about the type of education that we should be telling people, like myth versus fact.
People really need to know the facts, and our science and medical communities need to collaborate the facts communicated. Communication of clear facts, how the disease is contracted, how it is transmitted, and the procedures people should follow should all be clear to prevent fear and panic. It's important not to treat people unfairly based on fear, like in the AIDS epidemic of the 1980s, when there was even a suggestion that everyone that had AIDS should be tattooed, which is an extreme. Really knowing the facts and having the facts supported by credible science and medical communities will help American people understand and act appropriately. I think it's the lack of communication, or even the communication of misinformation, that will likely cause fear and inappropriate behavior.
Okay, how about the complications that Ebola raises for the rights of travelers and responsibilities of governments? For example, I know there was a nurse from Maine. It was Hickok, I believe was the last name. She traveled, she traveled to West Africa in 2014. She was from Maine. When she returned to the States, she was promptly quarantined, and she felt those restrictions, upon her were not, what she thought she should be subjected to. So, could you briefly discuss the difficulties of balancing individual rights and the government's responsibility?
I can. This is not an easy answer. Quarantine-related restrictions do keep people safe. There was a 21-day monitoring period in place to ensure people were not infected as they returned from infected regions of Africa. And people who take the risk to travel to those regions really must follow the procedures the United States has in place to keep other Americans safe. I believe it's a small inconvenience to ensure the safety of people around you. However, we're a free country and people have individual opinions, and I think, again, clear communication and lack of panic and cooperation of everyone is really a balance. Casey went on a bike ride while she was in quarantine. Clearly her quarantine, she was left her quarantine to take a bike ride, would probably not put her bodily fluids in contact with others, but honestly, to err on the side of caution, she probably should not have done that.
All right, let's change gears just a little bit. Let's talk about smoking and tobacco use, which is considered a big world health problem, and raises similar issues to Ebola in terms of rights and responsibilities. Just about everyone knows smoking harms health. What does that do to your body?
Well, smoking lowers your body's immune system and its ability to fight cancer. So smoking also changes the DNA in your body's cells, and DNA is your body's instruction manual, if you will, that causes a cell's normal growth and function. So when DNA is damaged, a cell can begin growing out of control and create a cancer tumor. Smoking causes cancer in almost anywhere in your body, including your blood, bladder, cervix, colon, the rectum, esophagus, kidneys, uterus, and so on. So really, not smoking is your best bet, but smoking definitely inhibits your immune system.
What about secondhand smoke? Can you explain what it is and how it affects people?
Well, according to the CDC, secondhand smoke is a combination of smoke from the burning end of a cigarette and the smoke exhaled by smokers. So secondhand smoke actually contains 70,000 chemicals, and hundreds are toxic, and about 70 can cause cancer. Since the 1964 Surgeon General's report, 2.5 million adults who were non-smokers died simply because they inhaled secondhand smoke. So, there really is no risk-free level of exposure to secondhand smoke, and secondhand smoke causes numerous health problems in infants and children, including more frequent asthma attacks and ear infections and sudden infant death syndrome. Smoking during pregnancy results in more than 1,000 infant deaths annually. And some of the health conditions caused by secondhand smoke in adults include coronary heart disease, stroke, and lung cancer.
Kim, people don't typically think of tobacco as a drug, like, let's say heroin or cocaine. But addiction creates a strong, isn't it? Should we think of tobacco as a form of substance abuse?
Yeah, absolutely. Most people get addicted to the nicotine, which is found naturally in tobacco. Quitting is difficult and sometimes takes several attempts. Quitting also has many side effects, such as feeling irritable or angry, being hungry more often, having trouble thinking, craving additional tobacco products. And really, the side effects are so difficult, which explains why many people have trouble when trying to quit smoking, and they just can't do it.
Kim, thank you for taking time out of your busy schedule to speak with us about this important topic.
You're welcome.